The next question a patient must ask their doctor before having dental implant surgery is how they obtain their education in dental implant surgery, and there are two major ways to do this. The first way is through a residency-based training program, and the second way is through CE, or continuing education training programs. A residency training program is a full-time program that lasts 2 or 3 years. It can be part of the specialty training that a periodontist receives, an oral surgeon receives, a prosthodontist receives. 2 to 3 years of training, and during those 2 to 3 years, the resident performs hundreds of dental implant surgeries under direct supervision. So by the end of 2 or 3 years, that resident has tremendous training and tremendous knowledge in the art and science of surgery, the biology of wound healing, the biology of implants. They truly understand how the system works, and they can apply that knowledge in a wide range of circumstances. Compare that with CE, or continuing education-based training. This training typically is what a dentist who hasn't been doing dental implants will take, who wants to start doing dental implants in his office. CE-based training typically involves a weekend course, 1 or 2 days. Some CE-based training programs are maybe 3 weeks of training, a week, and then they go back to their office for a while, and then another week of instruction, and then they go back, and then another week of instruction. Some programs are 1 day a month for a year or 2 years. But let's take that. Let's say it's 1 day a month for 2 years. That's 24 days of instruction. Compare that with what a resident gets who's in a training program for 2 or 3 years full-time and having their surgery supervised by a skilled surgeon. There's just no comparing. You're comparing apples to oranges. I started placing dental implants in 1988 during my residency training program at NYU, New York University College of Dentistry, and I was fortunate enough to learn from some of the titans in dental implant dentistry. Realized that dental implants were introduced to North America in 1984, and I began placing them in 1988. So I've been fortunate enough to follow the growth of dental implants really from the beginning. Following the completion of my residency, I continued my education with over 2,000 hours, 2,000 actual classroom hours of continuing education. I constantly take courses on the newest techniques, the newest innovations to bring these advances to my patients, to make their implant surgeries as simple, as comfortable, and as predictable as dental implant science will allow us.